Hi guys, Caroline Hooper, Certified Laser Specialist. Today I'm here with Amy, also known as Shapes and Shadows. Amy has been in with us to have laser hair removal treatments. How many sessions have you actually had so far? You're almost finished on the upper body and you've got, is it another one or two on the legs?
2, yeah.
Yeah. So Amy is, she's a blogger, so she's got a lot of clients, a lot of her followers would follow her on her journey for laser hair removal that she's undergone in the clinic, and she gets a lot of questions asked all the time, so she's brought the questions along with her today and we're going to be going through them with you guys today.
First question is, can anyone have laser hair removal?
Can anybody have laser hair removal?
Yeah.
Yes, I mean there's a couple of checks that need to be in place before we can determine if it's safe to go ahead with treatment or if the client is suitable. So best thing to do is have a consultation with a specialist. Medical check would be the first thing to check to make sure that there's nothing that's going to stop treatment from going ahead or cause any photosensitivity or any medications that will cause any irritations on the skin after treatment. Hair needs to be assessed to make sure that the hair is suitable for treatment as well, and once a patch test is performed to identify adequate levels for treatment and to know that there's not going to be any reactions after treatment, then yes, you're safe to go ahead with treatment, and it's pretty much for everybody except for anybody who has grey hair or white blonde hair. It wouldn't be effective to have laser hair removal done. But if there's pigment in the blonde hair, there is a lot of blonde hair that can be treated with certain lasers, not all lasers, and in that case that's where the assessment is so important, that if you're having your patch test you're identifying if that blonde hair is treatable.
Yeah, that was the next question. I have blonde hair and it's fine. Will it work for me?
If somebody has blonde hair and it's fine hair, again, it all depends on the pigment that's in the hair. If there is pigment in the hair, yes, of course it will work. We've had so many clients come to us and they might be opting in to have their lower legs done, and they ask us to check the hair on their upper leg, saying it's fine, it's blonde, I don't think it's going to work. When we look at the hair and we see the pigments and perform the patch test, we're getting a response. So there's many clients who feel their hair is too light, so it's always best to just go and have the consultation done. Diode laser is the laser that we use, and it is effective across all hair colours bar white blonde hair or grey hair, but like that lightly pigmented blonde hair can be treated.
Perfect. The next question is, I had laser hair removal done before at another clinic, therapy. I had 16 sessions on my legs and kept up my maintenance, but the hair still grew back.
Okay. 16 sessions, I guess it depends if they were done consecutively, because 16 sessions sounds like a lot to have consecutively.
Right.
Unless there's underlying hormones that's produced in hair, like PCOS, also known as hirsutism. And if that is the case, in that case you need to be continuously having treatments done every couple of weeks, every 4 weeks.
Right.
Does it say what area you was doing? Legs?
Legs,
on the legs. So the legs being a slower cycle, ideally the treatment should have happened for this client every 8 weeks, because the growth on the legs is slower. So that would tell me she's in treatment probably a good 3 years then, if she's had these done consecutively. She should be definitely seeing a result by now if the hair was suitable for treatment. I know the machines that they use in therapy are definitely good machines and they can give a really good result. So I wouldn't put it down to the machine, but a lot of the times it can be got to do with the person who's actually operating the machine. So you could have the best technology in your hands, but it's worthless if you've not got the right person operating it correctly to deliver the results. So all I could say really in this scenario is probably go back to the clinic and address the concerns, get them to probably check what's happened, look back over the file and see where the settings have been. Have they been adjusted as the hair changed throughout the course? Maybe question who was looking after her during her treatments, were they qualified to do the treatment, or operate the device to the standard that it needed to be to get the result for this client. And if there's no answers got there, then probably go to another specialist and see if they can assess the hair and give some answers.
Okay. What age can you have laser hair removal from?
So 18 is the age without parents' consent. Now in some cases under age 18 it can be done with parents' consent, but we would only in our clinic anyway undergo laser hair removal for anybody from age 16 to 18. If there's hormonal conditions and it's affecting confidence levels or self-esteem. So if it's causing problems in that side of things, we would definitely look into it and help out to boost the confidence, get rid of the hair, minimise it as best we can. But what to remember at this age is puberty is going to be producing new hairs because all the hormonal changes that are happening. So new hair is going to arise. So you're not going to get as long-term permanent effect from a course of treatments at that age than when you're past puberty. So guys, thanks for watching today's video. I hope it's helped you out. If you have any questions, leave them in the comments below. I'll also leave in the description below this video a couple of links with more information around laser hair removal, and make sure to subscribe to the channel as we do videos every day giving information in general on the aesthetic industry. So thanks for watching, and as always, feel beautiful, be happy, confidence is key.